It was a visit by the WHO Regional Director for Africa, but it also provided an opportunity for the Nigerian authorities to reel out a list of problems bedeviling the health sector. The health minister is, however, convinced that the achievement of universal health coverage will help make the issues things of the past.
We've been singularly focused on the achievement of universal coverage. We believe that doing so will help us to achieve quite a number of things. It will lift quite a number of Nigerians out of poverty. It will change the perspective of health to one that is contributory to national development. It will reduce the number of people who have to pay for health services out of pocket. It will change the profile of health and presentation in many of our centers from that of late presentation, because one of the reasons why people come late is because they do not have the resources.
He also explained that the Buhari administration planned to ensure that the revitalized primary health care system is sustained beyond 2019.
What do we expect to achieve? One, we want to achieve within the short term, in 2 years, a reduction in out-of-pocket expenditure by at least 20%. So that for us, we are looking at a situation where those who visit the primary care facilities will not pay at point of service. I've stated that that should be the non-negotiable part of the discussion.
The WHO Regional Director for Africa, Matshidiso Moeti, for her part, commended the transparency and accountability stance of the administration. She argued that these are needed in the health system while also assuring Nigeria of support in efforts to achieve universal health coverage and a sustainable primary health care.
Whatever we can do to support this process, both with advocacy and with technical advice, we are prepared to do from WHO. Just to say, as somebody who was born in South Africa, I was very happy to see that Nigeria is competing effectively with the country of my birth, because I have a strong belief personally that if these two countries do well, the African continent is going to do well. So I congratulate Nigeria for taking up the first position there, but recognize that a lot of work will need to be done to make sure that the transitioning in terms of budget allocation to health keeps pace with the growth of the Nigerian economy. So
the UN agency acknowledges that the Nigerian health system needs to be repositioned to enable the citizenry benefit from proper healthcare services. Chinomso Amadi, PTV News, Abuja.